Hello, and thanks for tuning in. Chad Robbins here with Robbins Plastic Surgery, and we're bringing you yet another video. This time it's a video that's part of a series, and it's a series on the concerns that some patients have in preparation for plastic surgery. And some of those concerns are cost, pain, recovery, scars. And today we're here to talk about anesthesia. Get a lot of questions about anesthesia with plastic surgery, and we're here today with James Stenson from Integrated Anesthesia Services. Their company's been working here in Nashville and really throughout the country for the last 15 years, providing outstanding anesthesia services. We've been working with them for the last 8 years. We've been very pleased with their service, and he's here today to answer questions about anesthesia and specifically anesthesia associated with plastic surgery. What different types of anesthesia are there, and what are the most common types of anesthesia in plastic surgery?
We've got a variety of procedures we perform here at the center, and so we really take great effort to tailor-made the anesthesia to the procedure that's being performed. And so with some of the shorter, simpler procedures, we're able to achieve both amnesia and pain control and comfort without the need for general anesthesia. For some of the longer, more involved procedures, the safest, most consistent route to go is to have a general anesthesia. Again, the center's well set up and certified. We've got all the medicines available to us that we need to be able to achieve that, to maintain their safety and comfort level all at the same time and perform, provide a good experience, try to get them back into their normal daily life as quickly as possible.
So good, safe, quick recovery.
Absolutely. Yeah.
And are you using a breathing tube or an airway on everybody?
Not on everybody. Some of our, again, the longer cases where we're just going to need that longer stretch of comfort and control, the safest route is to use a breathing tube. But again, that's something that's placed after the patient's asleep. It's removed before the patient's awake. It's not anything they're ever aware of. And then we follow them, whether it's the lighter sedation or the deeper sedation. We're here involved with not only before the procedure, but we follow along with them into the recovery area. So we take part in all the phases of their anesthesia from the time they get here to the time they leave to make sure their pain is well controlled and control things such as nausea and other possible complications.
Yeah, I think that's a really salient and key point that you made, because a lot of times, when I go to the hospital, the anesthesia provider in the operating room is not always the same anesthesia provider in recovery.
Yeah. Right.
And so I think that gives continuity of care to the service.
A chance to meet beforehand, discuss what different people's concerns or questions might be, to be a part of their anesthetic here during the procedure, and then transition with them into the recovery area and be involved in all of that. Really makes for a nice continuous effort. So.
Great. One of the questions we get asked a lot is, patients will ask, what do I need to do in preparation for surgery with regards to my medications?
Yeah.
And I know that there are a lot of medications that we tell people to stop on the surgical side because we don't want them to be at increased risk for bleeding.
Right.
Or we see a lot of weight loss medications. We don't want them to be taken the week before. But tell me, should I take my insulin the day of, or my blood pressure medication?
Sure. Well, we, just as a matter of safety, any blood pressure type medicines they're taking, we recommend they continue those. Continue the normal medications, even the morning of. If they've got medications they normally take for their blood pressure that morning, go ahead and take them, small sip of water. Anything related to blood sugar control, we usually have the patient hold those medications the day of their procedure. Mm-hmm. We'll have the ability to check their blood sugar once they get here, make sure it's within an acceptable range, but we like to have a little bit more control over blood sugar.
But that's only for diabetics?
That's just for diabetics, correct. Different types of medications for anxiety or chronic pain, we recommend that they continue those.
Yeah.
If you've got some medicines that you take on a normal basis for anxiety, or any chronic pain issues you might have, it's great to have those the morning of as well. You guys and your staff do a great job of making sure they've got their pain medicines they would need for recovery with them when they're here. That's a great transition. A lot of times we can begin those before the patient even leaves, so that there's not that gap in pain control. So.
Good. Anything else? Sometimes people will ask about a glass of wine the night before. Is it okay if I do that? I always tell cigarette smokers to quit. Cigarette smoking is so terrible.
Yeah. There's been research that shows some marked difference in the ability to stop smoking at least a week before your procedure as far as your lung health and your recovery, and I think it even plays over into scarring. I'm not the professional.
We tell them 6 weeks. The data on our healing is for 6 weeks.
So. As far as alcohol use, we recommend that after they receive anesthesia, they avoid alcohol for 24 hours, just as the interactions it'll have. Again, if they're using pain control medicine, by mouth after their procedure, they'll want to avoid using alcohol just for any interaction it may have. It's just a good policy to have.
Okay. One of the reasons that, so we're making these videos today about concerns that people have surrounding plastic surgery, and anesthesia being one of the more common ones. I will oftentimes ask patients, what is it about anesthesia that concerns you? And sometimes they'll have an experience with technically and arguably not anesthesia, but an experience with some sort of sedation during a dental procedure where they were uncomfortable. And sometimes they have other concerns that may or may not be so well founded. So what are the risks of anesthesia or concerns that you know about and can tell us about?
Yeah, and of course the patient will have a chance to meet with the anesthesia provider that day. Any specific questions or concerns they may have, we'll be able to address it up front before we do anything. Normally we get questions about, am I going to be awake? Am I going to remember what happened? Will I be uncomfortable? Again, we'll be able to tailor the medicines that we have to be able to address that specifically. As far as any risk of being aware during the surgery, we have everything available to us here to make sure that it doesn't happen.
That's a pretty solid note, all three of them.
Yeah,
awake, aware,
sure,
comfortable.
Yes, we try to do everything we can to minimize all the risks and all the possible complications, concerns they might have. Yeah. And again, the best time to address those is specifically with your anesthesia provider the day of your procedure.
So that's what I tell our patients too. A lot of people will report nausea with an anesthetic some other time in their life, and can you speak to that? Well, that's probably the most common thing.
Sure. We'll try to. Our goal is to make sure when the patient is done and leaving, they're well hydrated. They've received at least 1, possibly 3 medications to help control any nausea they have. We try to use our pain control judiciously in such a way that usually you see nausea from the pain control medicine. And so we try to tailor make it to their specific needs.
Yeah. And we tell all of our patients nothing to eat or drink after midnight the day before your surgery. Can you tell us why that's important?
Anytime we have the ability to control the amount of substance somebody has in their GI system, it helps us control any risk they would have were they to get nauseated and to vomit. And so really asking the patients to be NPO, to not have anything to eat or drink for a specific amount of time, really helps us control risk. Again, we try to make up for it with their IV fluids, trying to make sure we've got them rehydrated and stuff so that we can have them feeling as good as we can when they leave.
So we get asked this commonly. What happens while I'm asleep? Will I be monitored? What are they monitoring? Can you tell us a little about that?
Sure. We have all the complements of monitoring equipment required. Well, first of all, the anesthesia provider stays with the patient throughout. So we'll be here with you. We're also monitoring your heart rate, your blood pressure, the amount of oxygen that's in your blood, your temperature, all the different factors we can look at and control that would give us any indication that we need to monitor things or intervene in a different way. But we keep close tabs, continuous monitoring on you throughout the course of your procedure.
Yeah. I'll say also, having worked with these guys, they take a lot of care to monitor even your position on the bed. Mm-hmm. If they see pressure points, they'll put foam rests under pressure points and make sure that arms aren't hyperextended or overextended and things like that. You guys do a great job of that.
Thank you. We try.
We get asked this one a lot too. When will the anesthesia wear off?
Yeah. Again, a couple factors in that. One would be the type of procedure you're having done. If it's a smaller procedure where we're just doing some sedation, most of those medicines have a really short life to them. Once the procedure's over and we stop giving the medicine, it leaves the body really quickly.
Yeah.
Some of the longer procedures where we may be in here instead of minutes, we're here for hours. It takes a little longer for the body to get rid of those, whether it's through your breathing or just through your metabolism. And so, for some of our shorter procedures, their recovery period, half an hour. Some of our longer procedures, the average is going to be at least 45 minutes, maybe an hour for them to wake up enough to where they're, awake enough to be aware of their surroundings, to know whether they're comfortable or uncomfortable, be able to interact with their caregiver and with the person that's going to be going home with them.
And to be safe.
Sure, they're always safe when we're leaving, but the times that it takes for those medicines to wear off will be varied, and really the greatest factor has to do with the length of their procedure.
Yeah.
So.
When patients come here, I know that on the provider side for us, we have them get into a robe and in an exam room. We make sure that all of their questions are answered to their satisfaction. If they're female, we make sure they're not pregnant and do some other things in preparation. And then you guys go into the room, and that's where your part begins. Can you tell us a little bit about what the process is?
Sure. They'll meet their anesthesia provider for that day when they arrive. We'll have the opportunity to sit down and talk to them about their history, any medicines they might be taking, any surgeries they've had, any health issues or concerns they might have. We like having the family member present with us as well in case the family has any questions. Then we'll discuss their history, discuss the plan we have for their anesthesia for that day, and then make sure that they're consented for the same surgery they think and the procedure that they've come here for that day. We'll escort them back to the operating room when it's time. We'll make sure they're comfortable, start their IV, and then begin sedating them. We stay with the patient throughout the whole length of the procedure, and then again we're with them when they move into the recovery phase of things. So we're here for the whole duration of the time they're here in the facility. We'll be actively involved in their recovery period as well, making sure that they're comfortable, addressing any nausea or any other concerns that they might have. So.
Great. So that's one thing I can say that about that particular process that patients probably don't see is that you and I, or whoever the anesthesia provider is, will have a conversation about the patient before you all even go into the room too.
Yeah.
So that's one thing I think that's great about our relationship is that we're thinking about patient position, medications, length of procedure, safety issues, and needs even before you meet them. But
yeah, it's truly a collaborative effort, tailor-made just for that specific patient.
No, really, thank you so much for coming today. I know our viewers and people watching this video appreciate it, and I know I do too. Your time is very valuable. We appreciate you being here.
It's a great relationship we've got here. We really appreciate it, and it's a great service for the city. It really is. You've done a wonderful job building this facility and making sure everything's done top notch. We're just glad to be part of it. So, thanks for having us.
All right. Hasta luego.